Hello, my name is Dr. Edward Ratner, President of the American Academy of Home Care Physicians. The mission of the Academy is to promote the art, science, and practice of medical care in the home. Our members recognize that the home is an important site of medical care, especially for people who have mental or physical disabilities or a condition that makes it difficult for them to leave their homes, such as an acute illness. That is why we have made this video, a visual instructional tool on how to perform a house call. The house call was the typical model of medical care for sick people until early in the 20th century. Increases in healthcare technology and new healthcare financing and insurance models helped drive care from the home to offices, hospitals, and nursing homes. Although care by physicians in the home declined dramatically, it is now making a comeback. Why should physicians make house calls? Regardless of the setting, it is our job to gather information to make diagnoses, develop care plans, and educate our patients in ways to improve and maintain good health. In many situations, the home setting is an ideal location to gather information about patients' health and to determine the causes of illness and disability. In addition, going into a patient's home allows you to directly assess functional status and health effects related to the home environment. Simply put, by visiting your frail patients in their homes, you can obtain better information about their health and can more easily negotiate care plans with your patients and their key caregivers. Like many other procedures you have learned, making a house call is something most physicians will do often during their careers, even if you choose not to include house calls as a significant or deliberate part of your practice. In fact, studies have found that over 50% of primary care physicians make house calls in any given year. While there are portable tools that physicians can take to a house call for physical examination and testing, a well-stocked bag is not always necessary. Often, a mere willingness to step onto the patient's turf is all that's required. As you observe the next two scenes, try to pick out the key differences between visiting a patient at home and seeing a patient in the clinic. Think of the advantages and disadvantages of treating patients in their home, and remember the following. By bringing yourself to your sickest patients, you're remaining true to the art of medicine and the spirit of your profession.
Hello? Hello? Mrs. Fillmore? It's Dr. Johnson. Hello? It's Dr. Johnson.
Oh, hello, Dr. Johnson. Please come in. I must not have heard you.
I hope you don't mind me letting myself in.
Oh, heavens, no.
Well, it's so nice to see you, and thank you for letting me come visit you in your home today.
No, thank you for coming all the way over here. It's hard for me to get into the office to see you now that I'm not driving, and my son, he's working a lot.
It's no problem at all. I understand. That's why I came to see you. We miss you down at the office. We haven't seen you in such a long time. Where shall I sit? Is this...
Oh, this is fine.
Okay.
I hear better out of my left ear.
All right. So tell me, how is your son and the rest of your family?
Oh, Jack? Oh, he's fine. I'm happy for him. He just got a new job, and he seems to like it a lot better than he did his last job. Good. But he doesn't get to come by much anymore because he's working long hours.
Does Jack still make it over here, though, to help you with your shopping?
Oh, my, yes. He always comes on Saturday and takes me to the store to get groceries.
Good.
You know, I still like to cook and bake for when I have company.
Yeah, that's great. So tell me now, how have you been feeling?
Fair. I get dizzy spells once in a while, but I've been a little hungrier lately, so I've been eating all right.
Okay, so tell me, when is it that you get dizzy?
It's usually when I get up after I've sit a spell.
Oh, okay. And have you had any more falls?
Not lately. Thank the Lord in heaven. That last fall I had was a pretty bad spill.
And I'm sure you don't want another one of those. That was a nasty fall. Now, I see here from my notes from last time, Mrs. Fillmore, that you are still on several medications. Would you mind if I took a look at them?
No, that's fine. They're in that box over there.
This one right here?
Yeah.
These are the ones, okay. All right, and you set them up just like this?
You bet. Every Sunday, I sit down and fix that box because that tells me what I have to take and what I haven't gotten to yet.
Okay.
I would get twisted all around if I didn't have that.
Oh, all right then. And, all right then. Well, now, besides taking so many medications, how are you feeling otherwise? Are you getting up and around okay?
Oh, fair. I have my new Cadillac, you know.
Ah.
It moves a little faster than the cane, but I hope that I can get back on the cane again soon so that it's easier to get in and out of the car.
Well, now, can I take a look at how you're managing? I mean, would you mind taking a few steps for me?
Well, okay, give me a minute. I'm not as young as you.
All right. Oh, hold on a moment. I think we might fold this rug up and away so that you don't trip on it and fall with your walker.
That's probably a good idea.
Okay. That's good enough. Let's have a seat again. I'll help you back. Good, that looks great. All right then. Now there's just one more thing, Mrs. Fillmore. When I learned how to make house calls, I was told to always check the refrigerator. It helps me see how people are managing their food. And I'd like to take a peek in the bathroom for safety issues. Would that be all right with you?
That's okay, honey. Go right ahead.
All right then. I'll be right back.
I'd like to emphasize a few key points from the scene with Dr. Johnson and Mrs. Fillmore. Point number 1, knock on the door. Dr. Johnson knocked on the door and waited for Mrs. Fillmore to answer. Dr. Johnson knew her patient was hard of hearing, so she waited for a minute and then let herself in, but announced herself loudly. It is absolutely vital to respect the patient's home. Point number 2, ask where to sit. Before Dr. Johnson sat down in Mrs. Fillmore's apartment, she asked where she should sit. By asking in advance, she was able to sit on Mrs. Fillmore's good side, the side with better hearing. This helped to avoid a common communication barrier. By asking where to sit, you can also avoid sitting in a chair in which someone has recently been incontinent. Point number 3, sit down. In the home, it's natural to sit down and converse with your patient. In fact, it should be the norm in all settings, even in the hospital. It makes patients feel more comfortable and makes them feel less rushed. I'm quite fond of the phrase, a visit doesn't count unless you sit down. Point number 4, ask for a demonstration of function. In the home, you will be able to see a patient perform activities of daily living, as Dr. Johnson did. Watching Mrs. Fillmore get up from her chair and take a few steps told Dr. Johnson a lot about her ability to transfer and ambulate safely. Point number 5, ask to look around. Dr. Johnson asked Mrs. Fillmore to look in her refrigerator and her bathroom. Looking in the fridge provides a snapshot of Mrs. Fillmore's nutrition, memory, and ability to both shop and cook. Falls in the bathroom are quite common. An inspection of the bathroom can identify hazards and the need for safety rails. Now that we've seen a physician assess a relatively stable patient living alone, let's watch a scene where the doctor is addressing acute issues for a patient and his caregiver.
Well, Mr. Saunders, it looks like you have pneumonia again. Your fever, cough, and lung sounds all point to this.
Oh no, why does he keep getting pneumonia like this?
Well, remember when we talked about how the cancer in your husband's lungs makes it easier for him to pick up illnesses? Well, it also makes it harder for him to shake bugs off, and that's why the pneumonia keeps coming back.
I just don't know how much longer I can keep going. I just don't want to go back to that hospital every couple of weeks. Oh, I appreciate your coming to see me over here. I don't want to go back to that damn emergency room where they make you wait hours before you even see anybody.
That's for sure.
Well, I'm glad I saved you a trip to emergency. So, I guess we need to make some decisions today about this situation. Why don't we start with some tests? I'll have the home care nurse come over and take some blood, and they can also do a chest x-ray.
You can do that here?
Oh, sure. There's a company that'll come out and they'll do an x-ray in your house, and then they'll call me with the results later in the day.
Well, it's amazing what they can do these days.
Yes, I guess it is kind of amazing. Now, when you were in the hospital last, they gave you an IV with a medicine called Levaquin. It works just as well in pill form, so let's try that again and see if we can't get that to help you kick this pneumonia.
Sounds good.
I'm going to call the pharmacy before I go. Now, do you go anywhere in particular?
We go to the corner drug on Lake Street because they deliver.
Okay. Now, before I call, I'd like to know how you're doing, Mrs. Saunders. Been getting much help?
I'm doing okay. The nurse that comes over to the house here, she's really nice and she helps a lot. And then that Sue lady that comes to help him take his bath, she's a lifesaver because I could never help him get in and out of the tub.
Oh, that's good. How have you been sleeping?
Well, not so good. I get up with Joe when he needs to go to the bathroom, and then it takes a while before I can get back to sleep.
I know this is hard on Eileen.
Oh, I'm not complaining. The last thing either of us want is for him to have to go back to the hospital. We'll manage okay.
I'm sure you will. But just in case, maybe we should think about making a plan just in case things don't get better here. Now, Mr. Saunders, I know you're a fighter, but pneumonia can really knock you for a loop. What do you think? Are you guys ready to talk about this now?
I heard something about hospice. Can you explain that?
Sure.
Once again, I'd like to emphasize a few of the key points from the scene you just witnessed between Dr. Williams and Mrs. Saunders. Point number 1. House calls can address acute complaints. An urgent office visit for someone who's feeling poorly and has limited mobility may be impractical or even unsafe. Dr. Williams' home visit may have prevented the discomfort and expense of an emergency room visit. Point number 2. Home-based testing is possible. Virtually all office tests can be performed in the home, too. Phlebotomy can be done by the doctor or arranged through home care agencies in your area. Physicians who do a lot of house calls will often carry point-of-service blood testing equipment and a pulse oximeter. Radiography, electrocardiograms, and Doppler studies can also be done in a patient's home in many communities. Point number 3. The caregiver is part of the care team. It is so critical to assess the coping of caregivers, as they are essential to keeping acutely or chronically ill patients at home. Caregivers may be more open with their frustrations or limitations when interviewed in another room away from the ailing loved one. Talking with the caregiver privately is much more easily done in the home than in the office or clinic. As a physician, you should be familiar with caregiver support services in your community, or be prepared to refer your patients and their caregivers to social work services. Point number 4. Care planning is ideally done in the home. Dr. Williams' home visit was the most appropriate setting in which to develop a care plan with the Saunders. Being in the home allowed Mrs. Saunders to ask questions about the things that concerned her and probably made both her and her husband feel a bit more relaxed. Joint visits with a home care or hospice professional is another way to create an interdisciplinary care plan. Hopefully by now you know most of the basics of making a house call. Making house calls is an enjoyable and rewarding activity and an all too important service for the functionally and mobility impaired patients in your practice. In addition, changes in Medicare reimbursement for home visits over the past few years have removed some of the financial barriers to making house calls. On behalf of the American Academy of Home Care Physicians, thank you for your attention.